Turning now to the spread of the H1N1 swine flu. As of this morning, 18 countries around the world have reported cases of the flu within their borders. 26 deaths so far, 25 of them in Mexico, and 1 here in this country are being attributed to this flu. Across the United States, New York, Texas, and California have the most reported cases, while 32 other states also now are reporting patients testing positive, bringing the total here in the U.S. to 245 cases. But there may be encouraging signs in all of this morning. CBS News correspondent Bianca Solorzano is live at St. Francis Prep in Queens. That is the school at the center of the U.S. outbreak. Good morning, Bianca.
Hi, good morning, Maggie. The largest cluster of H1N1 virus flu cases was right here in Queens, New York at St. Francis Preparatory School. The school was closed for a week, but it is finally reopening this morning. And as more confirmed flu cases pop up across the United States, U.S. health officials are still cautiously optimistic. After a week of disinfecting and recovering, students at St. Francis will be packing some new school supplies this morning. Will you do anything differently when you go back to school?
Definitely be more careful with the contact. I already bought like a family pack of hand sanitizer.
Across the country, more than 470 schools are closed in at least 18 states. Around the globe this weekend, Canada reported the first known case of H1N1 virus passing from an infected human to pigs. In China, authorities have quarantined Mexican tourists in hospitals and hotels. And in Mexico, where the outbreak began, cautious optimism from health officials, saying the virus is in a declining phase. But officials in the U.S. aren't so sure.
When we look at this virus right now, we're not seeing some of the things in the virus that have been associated in the past with more severe flu. That's encouraging, but it doesn't mean we're out of the woods yet.
Yesterday, U.S. health officials said the median age being affected by this virus, just 17 years old. There's a chance that older people are not being as affected because of years of previous flu vaccines. Maggie?
Bianca Solorzano in Queens. Thank you, Bianca. Joining us now from Atlanta, Dr. Richard Besser, the acting director of the Centers for Disease Control. Good morning, Dr. Besser.
Good morning. How are you?
Fine, thanks. We're hearing Mexican officials this morning starting to downplay this. They say cases there are now declining and they believe the worst is over. Are you ready to make the same declaration here in this country?
I'm not ready to say that. There is encouraging news, and in your story you covered that. We're seeing this virus spread around the country, and what we're seeing is an illness that looks very much like seasonal flu. But not to downplay seasonal flu, each year 36,000 people die from seasonal flu. But we're not seeing the type of severe disease that we were very worried about.
Every day since we have spoken, since this began, Doctor, you have said that we are expecting and you expect more deaths in this country. Is that still the case?
That is the case. Influenza virus can cause very severe infection. People have different underlying medical conditions. We're seeing infections in almost every state, and I expect very soon we'll have reports from every state. And as that occurs, those who have underlying problems may be affected more. You were commenting about the elderly, and it may be that they have some protection from previous exposure. It may be that this disease is starting first in children and then will spread to the elderly. So there's more that we don't know.
But the fact remains we have only seen one death. It was a little boy from Mexico who had a pre-existing condition. We don't know that this is any worse than a regular flu. Given all of that, do you believe that the 500-plus schools in this country that are closed should not be? Are these school districts overreacting?
You know, as a pediatrician and as a parent, I know the best place for children is in school learning. But we need to balance that with health risks. And until we know
that
schools are a safe place to be. Well, I think we're gaining more information, and we may be able to make some movement on that. We close schools to prevent transmission from children to children, but also to prevent spread in the community. As we learn and see that this virus is not more severe than regular flu, an approach of people who are sick stay home becomes a more reasonable approach.
If I could ask you in the last 10 seconds to address this, because now we are actually seeing a case of this flu in pigs in Canada. Any reason to worry about the food supply now?
You know, it may be that pigs have more to fear from people than people have to fear from pigs. What we were hearing from Canada was transmission from a person to a pig. The USDA is very carefully monitoring our pig and swine supply here and has not seen any disease in that population.
All right, as always, Dr. Richard Besser, we appreciate the update.